had a dull ache in your lower back, tightness in your neck? It may seem minor, but small spine issues can actually snowball quite quickly. In this video, I'll explain why early spine symptoms matter and what they could be telling you, and how catching them early can actually save you from years of pain. Hi, I'm Dr. Deeptee Jain, and I'm an orthopedic spine surgeon. I've seen it way too often. People wait too long to address back or neck pain, only to wind up in chronic pain, and maybe even have surgery. My goal is to help you avoid that. Subscribe if you want to stay ahead of your spine problems with simple and actionable advice. So what are early signs of a spine issue? You could watch for the following: persistent dull pain in the back or the neck, stiffness that's worse in the morning or after sitting, numbness and tingling or pain radiating down your arms or legs, fatigue when trying to stand with good posture. These aren't random. They're your body's warning signals. And the earlier you listen, the earlier it is to help improve those symptoms. Keep in mind that these symptoms aren't necessarily worrisome, but there are small lifestyle things that can be done to keep your spine as healthy as possible. Most spine conditions like disc degeneration, arthritis, and even nerve compression start silently. What begins as a mild discomfort can develop into sciatica, chronic stiffness, or even spinal instability. Acting early means that you have more options, usually fewer complications, and hopefully better outcomes. Since most common spinal conditions begin with barely noticeable signs, these are things that you might experience. A herniated disc may show up with numbness or weakness. Spinal stenosis can present as leg fatigue or balance changes. And postural issues can lead to muscle strain and joint wear if not corrected. In fact, even among spine surgeons, there's a high rate of cervical spine problems in spine surgeons because surgeons often hold their neck in a flexed position for long periods of time, like this, while performing spine surgery. The earlier you spot these, the better you can be about managing them. So let's be honest, most people ignore spine symptoms because they think it's just age, stress, or something that'll go away on its own. But pain is your body's way of asking for help. Ignoring it can lead to more expensive, complex treatments down the road. So if you're noticing these early signs, here's what you can do. Start with an early full evaluation, and that may include imaging like x-rays. Begin gentle mobility, stretching exercises, and strengthening exercises. Remember, a body in motion stays in motion. Address posture, sleep position, and daily habits. And talk to a doctor about physical therapy, maybe chiropractic care, or other non-operative treatment modalities. Early action often means non-surgical solutions. If you work at a desk, lift heavy objects, play sports, or you're pregnant, you might be at higher risk for developing spine problems. These groups often ignore spine symptoms until things escalate. Don't make that mistake. Listening to your body now is the best investment that you can make in your future mobility. So let's recap. Early signs of spine issues include pain, stiffness, numbness, and potentially posture fatigue. These are often the first warning signals. Acting early allows for easier, non-invasive treatments and potentially better long-term outcomes. If this helped you rethink that nagging back or neck pain, hit the like button and drop a comment with your experience. Have you been ignoring early signs? Did early treatment help you? I'd love to hear about it. And don't forget to subscribe. I share new spine health tips every week.